Now, I did talk about our aging infrastructure. The picture at the bottom here is actually, believe it or not, um, it is a wooden water pipe. And back in the day, this is what they made water pipes out of. Steel bands around carved pieces of wood. And the wood would swell and kind of hold it all together. But as you could imagine, probably leaks a lot. Um, we also have other issues. There's certainly lead pipes still out there. There's different compounds in different types of pipes, so we can leach out cadmium, iron, and zinc, and nickel. There was a period of time where we were using asbestos in the pipes in certain urban areas, and then the chlorine that comes through these pipes will interact with the wood and other organic material and form trihalomethanes, which is a whole nother area of an entire evening of discussion, really. But essentially, anytime you're heating hot water that's chlorinated, you're going to form trihalomethanes. So think of showers. And yes, most major cities in the US have wooden water pipes somewhere within their distribution center. Flocking agents, just a quick note on chlorine. Lifetime users of chlorinated water have been shown to have a greater increase for bladder cancer, and that approximately 25% of all bladder cancers in non-smokers can be tied to chlorinated water. Aluminum as a flocking agent used to eliminate odor and color in certain water treatment systems has been associated with Alzheimer's as well. So then we come to the faucet. So we've left contamination in the ground and the source of the water. We've left contamination in the treatment system and the distribution system, and now we're right at the tap inside the house. Lead. If you live in a Victorian house, you may still have lead plumbing. Solder and distribution system components like elbows and fittings were banned to have lead in 1988, which to me seems like very recently. And we've seen lead, of course, affect memory, learning impairments, hyperactivity, high blood pressure, and is responsible for underweight newborns. So where are our routes of absorption? So we have these contaminants. We're pretty certain that they're in the water. Are we actually going to be exposed to them? Well, we're typically drinking 16 to 64 ounces of fluids per day. We may be cooking food with this water. We might be steaming or boiling vegetables and pastas. We might be looking at other routes such as bathing and showering, steam exposure and inhalation, or dermal exposure. Hot showers, of course, increase circulation to the skin and, of course, form trihalomethanes. And if you use non-organic products, you're probably using some sodium lauryl sulfate, which is it basically increases the permeability of the skin. So all of these factors, the bathing, the inhalation, the chemicals that are in the products we use, are not part of the exposure limit setting in the toxicity limits for the US EPA drinking water standards. And then we talk about children. Well, children have a large surface area to weight ratio, so very small weight compared to the amount of skin that they have to absorb toxins. They also tend to take longer baths. Personally, I remember staying in the bath a long time until all the bubbles were gone. They're also continually developing their organ systems and their neurology. They have a higher circulation rate, higher pulse rate, more blood flow to the skin. That's why they're always pink. So, I mean, there's just so many reasons that children are at risk. So if you have kids, you might want to consider a whole house filter system. If your patients have kids, you might want to suggest that as well, just for the simple reason they're a big, larger risk pool. So the other risk pool is the elderly and those who are immune compromised. So we know that they have decreased kidney, liver, and GI function, lower immune function, sometimes compromised detoxification pathways. They have lower caloric intake and decreased metabolic rates, and many times compromised barrier functions. So all of that makes them sort of more porous and less able to excrete and detoxify. So they accumulate faster than healthy adults. So the bottom line here is know what's in your water. Get it tested. So it's kind of like doing a urine analysis. You test first thing in the morning. You get a clean catch, which means you don't want to catch whatever's on the tip of the faucet. So you clean off the tip of the faucet, and then you sometimes even unscrew that aerator and then catch your sample out of that. And then you need to know how to read the test, just like any diagnostic test. These two sites will help you do that. Most places that are like the Department of Public Health or a water testing lab will spend some time helping your patients interpret their tests. So test it first before you jump into buying filters, because filters can be expensive and you want to make sure you're filtering the right thing. So with that, let's get into the filter types. So these are listed most common to least commonly used. You see a lot of carbon filters on the market, followed by ceramic, ultraviolet light, and then reverse osmosis, distillation, and ion exchange is the most rare and probably the most expensive. Each has its own benefit, disadvantages, things it treats and doesn't treat, and we're going to spend a couple minutes going into that. So are there standards for filtration? Yes, you bet there are. And if you are looking at a device for treating water and it does not say it meets these standards somewhere on the device itself, you should seriously question whether or not it's worth your money.